Now, as lockdown level 3 kicks in today, there will be more movement of people, of course. The President and health authorities have also emphasised that people's behaviour will now determine how quickly COVID-19 spreads. So a reminder on the importance of taking care. To discuss, we're joined by Professor Mosa Moshabela, Dean of the School of Nursing and Public Health at the University of KwaZulu-Natal. Prof, thank you. Some people are critical of the approach, but is it fair enough for government to say now a lot of what's going to happen is in our hands, literally?
Yeah, I think it's a powerful statement. Thank you very much for inviting me. And I do think that it's actually very true, given the fact that level 5 and 4 were really imposed by government. The state, in a way, was taking responsibility on imposing social distancing, which, of course, that's what the lockdown really was about. But going forward into the lower levels, really, the responsibility shifts from the state. It shifts towards society, to individuals, to communities, to companies, to industry, to various other sectors of society. So it is true that, it is in our hands now and no longer really completely in the hands of the state, except we still need the state to create an enabling environment. We need industry to create an enabling environment. But otherwise, I do feel that during the lockdown, we could have also done enough to prepare people to take over that responsibility, because we are not used to it. We are used to the state taking responsibility. But we need to recognize that, if you're going to ask someone to get into a car and drive, and navigate one destination from here to another destination, you also have to teach them how to drive. And we haven't done enough to really teach our people how to navigate this uncertainty in terms of social distancing. But, I do think that, it's as long as we could wait, and you will have to see how we move forward.
You sound cutting a little bit. So I guess what you're saying is education, ongoing education is hugely important. And let's take this opportunity. Physical distancing or social distancing is important. Just remind us why it makes such a difference if you stand close to someone, half a metre away from someone, or 1.5 metres away, which is what is recommended.
Yeah, Francis, it's about the type of droplets that can come out from one person who's infected to the next one who's not infected. The big droplets will fall within a meter. The medium droplets will fall within about 1.5 meters. And because of that, we just need to make sure that we keep that distance, so that the further you are away, the more likely you are to stay away from the droplets. But even better, it's better when we have masks, because then when we've got the masks, then it helps in order to limit the distance, to which the droplets can travel.
Yeah.
And also in terms of the surfaces around where that you might be touching. If you're keeping the distance, you're unlikely to touch surfaces that other people are sneezing on or coughing on or breathing onto. Yeah.
And in the United States, we saw some pushback to wearing masks, which is incredible, because it doesn't protect you as much as other people around you. I mean, is this actually becoming a moral issue?
It is, definitely. I mean, the fight against COVID-19 is so layered around so many other issues, and we can see it all over the world. And so Brazil is the same thing. If you were to look, Brazil is a country that is similar to us. But if you were to look at how the pandemic has unfolded, we don't want to be Brazil right now. So
what did they do
it is
wrong?
A moral issue.
How can we learn from them? What did they do wrong?
Francis, their president didn't want to use masks. He was discouraging it. He didn't want lockdowns. He was listening to President Trump. So we don't want that. It's a moral issue in the sense that, as society, we had become so closed and so selfish, so to speak, and we have lost this sort of idea of humanity, Ubuntu, and caring about someone else. And now, as I'm just listening to the interview before mine, I'm listening to business sector really thinking about how to protect people, how to do business differently. And I can see that through COVID-19, we have learned hard lessons that are really making us step back and think about how to do things in ways that can protect other people. And that's really important. And we need to build on that.
One of the debates has been whether the science supports the different levels of the lockdown like we've got, but the World Health Organization does say come out slowly from a very hard lockdown. I mean, what's your comment on the way things are being done as we slowly open up again for now?
Yeah, look, one part of it is science, but science is not the only thing that matters. Logic matters. And I think also your reality matters. If you look, for example, at Sweden, where at the baseline, they've got very strong health promotion behavior structures on the ground. We are not Sweden. We are a country that interacts. We touch each other. We are more like Italy. We engage socially. So if at the baseline you are having a situation where contact is very high between people, and unlike what you might see in Asia, for example, in Japan or in South Korea, then you know your approach needs to suit your context. And your context may not necessarily have the science to support what you're supposed to do. And it's fair enough to debate it and argue against it. But at the same time, I think at this point, no one can really argue about whether the lockdown was good for us or not. No one should argue, unless they're being irrational. But we all understand that no doubt the lockdown was better for us because we were not going to afford to see what we're seeing in the Western Cape happen throughout the country. We don't want that.
Yeah, because the numbers show that the curve has been flattened. I mean, we can look at those trajectories and say that is a fact.
Yes, that is a fact. And remember that just because you've got one province, for example, like Western Cape being an epicenter in South Africa, it doesn't mean that all provinces, Gauteng, KwaZulu-Natal, Eastern Cape, have to all be epicenters. In China, it was only Wuhan and Hubei that were the main epicenters. In the state, it was New York and the New York state. In Italy, it was Lombardy and Milan. So it doesn't mean that we must all kind of surrender ourselves to the fact that we're going to have all our provinces become epicenters. As long as we learn from what's going on in the Western Cape and we prevent it from happening in other places, then we would have learned our lesson and we can reshape the way we respond to COVID-19.
All right, thank you for your time tonight. That was Professor Mosa Moshabela from the University of KwaZulu-Natal.